welcome to the SVG-TV news for Monday, November 8th. I'm Khalil Kato with the details. 23 new positive COVID-19 cases were reported from 146 samples collected on Friday, giving a positivity rate of 15.8%. 9 new positive results from rapid antigen tests were also reported from flu clinics on that day. And 3 positive cases were reported from 33 samples collected on Saturday, resulting in a positivity rate of 9.1%. 2 positive rapid antigen results were also reported. Yesterday, 5 new positive cases were reported from 12 samples, resulting in a 41.7% positivity rate. There were no new rapid antigen positive results. There are currently 13 patients admitted for COVID-19 at the Argyle Isolation Facility. All are said to be unvaccinated. 17 patients have been admitted to the COVID-19 wards at the Milton Cato Memorial Hall. That should be the Milton Cato Hospital, with 15 of these being unvaccinated and 2 partially vaccinated. No deaths were recorded over the reporting period. 20 new recoveries were noted over the reporting period, with there has been 1,107 cases are currently active. 69 persons with COVID-19 have died. 5,123 cases of COVID-19 and 3,947 recoveries have been recorded in St. Vincent and the Grenadines since March 2020. With dengue fever still being a problem on island, Prime Minister Dr. Ralph Gonsalves is appealing to Vincentians to keep their surroundings clean to reduce the breeding sites of the Aedes aegypti mosquito, which is responsible for the spreading of dengue fever. The Prime Minister was at the time speaking on NBC Radio on Friday.
I'm asking everybody, make sure the surroundings are clean. Don't have receptacles with water in there to breed in the mosquitoes. Please. It's your community. Your body, your community. Johnny P?
Yes, of course, of course.
Your body, your community. And your body is affected by what happens in the community. Please. We're doing what? We're doing the fogging, we're going around, we provided resources, additional personnel, but we want the cooperation also of people, of everybody. Let's stay healthy.
Prime Minister Gonsalves noted that so far there are 124 confirmed cases of dengue fever in the country.
There's been some commentaries about dengue. So, I will ask for the data, and the data, the people, the epidemiologist, Tamara Bob, is doing a very good job. I have data with a lot of charts, and if we look over the past, for instance, go back to 2011, you had 47 cases of dengue. 2012, 248. 2013, 120, 2014, 11, 2015, 19, 2016, 16. I didn't see any reported there for 2017. 2018, 6. 2019, 3. And then, remember the big year in 2020, when we had to do a lot of cleaning up, when you had 1,595 cases. For 2021 thus far, the numbers are down to 124.
The Prime Minister further spoke on the deaths due to dengue fever over the last year, which at January 2021 stood at 8, including 5 children.
2020 had 7 deaths from it. This year you had one in January and one in September. In fact, between September to November in 2020, when it was very bad, we had 7 deaths in that period. Now, since September, we have only had 1 death. But it was 1 death too many.
In a circular issued to all heads of educational institutions, the Ministry of Education said that with immediate effect, schools are to revert to the recommendations provided by the Chief Medical Officer that were implemented during the last academic year to reduce the spread of dengue fever. According to the ministry, all students are permitted to wear long pants, tights, and long-sleeve tops if their parents desire for them to do so, and urged all stakeholders to work together to provide a safe environment for all users of schools. The The Mental Health Rehabilitation Center has recorded a number of suicidal ideation cases due to stress brought on by the COVID-19 pandemic, the eruption of the La Soufrière volcano, dengue fever, and other challenges facing the country. This is according to a counselor at the center, Elika Matthews, who told SVG-TV News today that most persons who have been experiencing stress have been coping negatively.
From mental health, what we have been seeing is that people have been dealing with stress in different instances. So there are persons who may be feeling sad, who may be feeling distress, and they shut down. There may be other persons who feel stressed and they're motivated, but something we have recognized is that persons who are experiencing stress have been coping negatively, meaning they have not been doing their work, they have not been engaging in the day-to-day activities that they previously enjoyed, and to some extent we have seen people who have been engaging in suicidal actions. And there are persons who have expressed suicidal ideation, that being that they want to hurt themselves in some way. So we are encouraging persons, if you are having these negative stressors, to reach out to us at the Mental Health Rehabilitation Center at telephone number 4586-185 or 4584-240. We understand that some persons may cope well, but there are others out there who may need the additional help. So if you need this help, don't be afraid to reach out to us.
Matthews said stress is the body's response to what's taking place around it, whether negative or positive.
And we want persons to be reminded that stress can go one of both ways. Stress can be a motivator to help to propel us to get the work done, or stress can cause us to shut down, and we want persons to be mindful of what is happening with them. When we think about stress, we think about many things that have been happening now in our society with what has been happening with COVID. So we're thinking the loss of a loved one, persons getting sick, having to quarantine and not knowing where you go from here. But we also have to be mindful that there are different things that can contribute to stress, not just the loss of a loved one, but not having a job or going to work and it not turning out how you would like, the loss of a loved one, the loss of a friendship, school stressors. Different stressors can contribute, but what we want to do is remind persons to make sure that they're coping well, to not let this stress get the best of them, but to stop and plan and decide, where do I go from here.
Meanwhile, social worker at the Mental Health Rehabilitation Center, Chanel Ned, outlined some coping mechanisms that persons can use while dealing with stress.
Of stress, we are not just talking about the social effects. We have to consider the physical effects that it can have on a person's body as well. So you might find persons start having an increase in headaches. For persons who are suffering from diabetes or hypertension, you can find that their hypertension numbers are going up or dropping, and the same for them being a diabetic. In addition, we have to think about the mental health, where there are persons who are already suffering from a mental illness, and this may further make it worse, or you may see the development of mental health illnesses as it relates to depression and anxiety. So we're just encouraging persons to be mindful of the effects that it can have on your body. You see an increase in your irritation, your agitation, getting upset, or completely shutting down. These are things that we want persons to be mindful of when it comes to their health and their stress levels.
Anxiety and fatigue are two of the mental health problems that have been observed in teachers and students as they try to transition in the blended learning approach. Schools across St. Vincent and the Grenadines reopened on Monday, November 1st, with full face-to-face classes and a blended format. The recommended format for the operation of schools island-wide was based on the percentage of vaccinated staff and the adherence to health protocols. Speaking on NBC Radio's face-to-face program this morning, counselor and lecturer at the St. Vincent and the Grenadines Community College, Andrea Games Moes, said that some parents, teachers, and students are finding it very difficult to adjust to the blended learning format.
At home, but also in the blended approach, I think some classes are also going to be online where even though you have that coming into the classroom, you also have where some classes you're at home and you're online. So making that transition is difficult because it means you have to pay attention to what day you have class in school. For some schools are doing that different approach. So being in mental health, some of the observations and some of the feedback that I'm receiving is a lot of anxiety in terms of making that transition. You have a lot of fatigue as well. And I think we also sometimes overlook that our children and our people have gone through so much in the last 6 months.
While there are challenges with this format, Moes says the majority of children are relieved to be back in the classroom, which is an environment they are accustomed to.
Also, you see where you observe where students are actually looking out for each other as well in the face-to-face setting, where they're checking in with each other to see if, did you get to work? But I think parents too can breathe a little sigh of relief, because where before you would have had that everyday checking in, and I think different schools have different methods based on the ministry's policy, but there's that high, a little level of hope that they don't have to monitor as much, that the teachers and the classroom setting can give them that sense of break and relief. And I think for teachers as well, they have a little more interaction with their students, unlike being in a full online setting as well.
And Prime Minister Dr. Ralph Gonsalves said that the government has recognized the importance of psychosocial support in schools for teachers and children, noting that some mental problems can cause severe damage to the body. Speaking on a recent program on NBC Radio, Prime Minister Gonsalves said that the Ministry of Education has put several measures in place to support teachers and students mentally in going back to school for face-to-face instructions, including placing counselors at all schools.
In how you bearing stress. Stress could kill you, especially if you have some pre-existing condition, especially your diabetes or hypertension, and you get additional stress on you. It could create problems to other organs in your body. Your heart, for instance. The doctors can call and talk about these things. I'm talking about what I read, and if I'm talking foolishness, they say, Ralph, you talk foolishness, that's fine, and I withdraw it. But I happen to know that you gotta know how to deal with stress. Yes. And the psychological support is as important. And this is something which the Ministry of Education is pushing. The Ministry of Social Development is pushing.
PM Gonsalves further noted that in the aftermath of the eruption of the La Soufrière volcano, at least 1,000 vulnerable families have received psychosocial support through a UNICEF-sponsored program.
Additionally, since La Soufrière, there are 1,000 families and 500 being dealt with right now, the most vulnerable families, through a program with UNICEF. We have done training of trainers, and they in turn are training others and working with the 500 vulnerable families and providing supports. Unfortunately, some of the families who are very vulnerable, they don't quite understand yet the need for the psychological support. Many of them do. Some are more interested in the material support.
The World Pediatric Project has seen a decline in the number of children attending their medical missions clinics this year due to the COVID-19 pandemic. In a recent interview with SVG-TV News, Executive Director of the WPP for the Eastern Caribbean, Lauren McIntosh, said that each year they would have 12 to 15 medical mission teams coming to SVG to work with children experiencing different medical conditions. However, due to the COVID-19 pandemic, only 3 groups have visited thus far.
This is actually the 3rd team in 2 months, for World Pediatric Project. We had one in September, which was general orthopedics, and we had one earlier this month, which was a diagnostic cardiology clinic. The teams have been doing quite well. There's been a bit of a lapse in terms of our teams coming back as a result of the pandemic and the challenges that we're facing. However, we're excited that we're back here on the ground and we are able to see more children once again. So it has been all in all good. We do have plans. We have one other team probably coming before the end of the year, and then next year we hope that we will pick back up full speed. Our usual number of teams is 12 to 15 teams annually. So hopefully we'll be back on schedule. I would say thus far we've probably assisted about 125 children with the last 3 teams that have been on the ground, and a number of them have had surgeries with our teams.
McIntosh is anticipating one more medical mission before the end of the year. She also used the opportunity to thank all those who have helped to make the 3 recent medical missions successful.
We have to definitely thank all involved in making this possible, from our medical volunteers and the team that's here on the ground, as well as the Ministry of Health, who has always acted in collaboration with WPP, the staff at the Sion Hill Health Clinic and the community nursing staff, as well as the hospital administrator and all of the support staff at the operating theatre and Milton Cato Memorial Hospital.
Over 200 vaccinated applicants will be interviewed this week for possible recruitment to the RSVG police force. This is according to Prime Minister Dr. Ralph Gonsalves, who made this disclosure on Star Radio's Morning Scoop program this morning. Prime Minister Gonsalves said that there will be a process of interviewing that will eventually lead to final selection of candidates. He noted that it is expected that the police force will accept approximately 110 of the applicants. The Prime Minister also noted that some auxiliary members will be selected for recruitment.
And for the whole of this week, I believe, they would be the team, the leadership team at the police headquarters. They'll be interviewing applicants for the police force. I think they have 200 and something names.
Wow.
Of pretty good candidates. And all of them are either fully vaccinated or they've had their first dose. And there would be a process of interviewing leading towards final selection. We may take in maybe 100, 110 or thereabouts. I would expect also that some auxiliaries would be taken in, because we are into a period where I believe that some of the further restructuring that we have been talking about, some has happened and some still to be done.
Prime Minister Gonsalves further noted that a lot of police officers have been taken up with stationary duties and expressed how the leadership of the police force may restructure departments to function more effectively and efficiently.
There are some things, for instance, a lot of police officers have been taken up in doing stationary duties, a number of SSU officers and others. What you probably need to do is to have a personal protection service. That is to say, protection officers for Prime Minister, Governor General, judges, magistrates. So you can have a unit in which you have a mixture of policemen and women, and also auxiliaries, because the auxiliaries are also good candidates are coming through. So you can reshuffle some of that, and some of the more experienced officers, you don't necessarily have to put them towards having stationary duties, like, for instance, standing guard at a particular mission, embassy or something like that, or residence of a country. So that's one area. You can restructure the work situation differently, and you can have even more vehicles. A lot of vehicles, it's more mobile. So you may not need as many officers at one time at the station.